I'd like to talk to you today about a new mobile pain treatment program for peripheral neuropathy in Virginia. So what we have is called the RELATYV Mobile Pain Treatment Program. This is where nurses who are mobile will actually travel around in Virginia and actually deliver this treatment program to your home or assisted living center, wherever you are. So the program itself, what the actual program is called neurofunctional pain management. And this is a program that I developed years ago, back in 2018, to actually operate inside of doctors' offices as a pain treatment program. The three components of neurofunctional pain management are: one, electroanalgesic therapy; two, IV nutritional hydration therapy; and three, uh, health coaching. So those three components are the three primary aspects of neurofunctional pain management. So ultimately, here talking about neuropathy, I understand a lot of people out there watching this have chronic peripheral neuropathy. It's difficult, it's painful, numbness, burning, tingling, all of those things. I understand. Talk to hundreds and hundreds of patients with this condition by working through all these offices. It's very difficult to treat. Most doctors do not have effective treatment options for patients. Most of the time, it's just a medication prescription, and that's all there is. So you'll see a lot of doctors will just say, "Hey, try these meds," and they'll work until they wear off, until they stop working. And then the other option is to potentially do some interventional procedures. But I don't see a whole lot of those being offered for people with chronic neuropathy, just because a lot of those interventional procedures are not necessarily designed for that condition, because that's a little bit more complicated to treat. So that being said, there's not very many options for peripheral neuropathy, and that pain can be a problem. Over the years, when we operated inside of doctors' offices, we also noticed that that was actually one of the hardest conditions for patients to get in and out with. So they would have a hard time even just getting from their home to the office, and walking around was just painful and difficult. So we had a lot of people who actually did not want to engage in the program just because they couldn't do the traveling, they couldn't deal with the pain of moving, and so that was an issue we had to deal with often back then. So going mobile was ultimately going to be the thing that we knew was going to work, and converted it to the mobile program, and it's been working great. Again, offering a mobile neuropathy pain treatment program in Virginia now, with nurses that we have available in Virginia. So, okay, the three components of neurofunctional pain management. We've got electroanalgesic therapy, health coaching, and nutritional IV hydration therapy. Okay, electroanalgesic therapy. I know most of you never heard of it. Most of you have never heard of any of this. So you've got electroanalgesic therapy is a high pulse electrical current. It has been FDA cleared and in the market for probably almost 40 years now. It's not new. It's been around for a while. But why haven't you seen it? If it was so great, why doesn't everybody have it? And I get that question from patients all the time. If it's so great, why haven't I heard of it before? And I've actually had the exact same, and with the facial expression, from doctors, many doctors. Well, if it's so great, why haven't I heard of it before? Right? And there's lots of reasons why they haven't heard of it. But the reality is, it's gone through its trials. It's been FDA cleared for the treatment of pain and vascular stimulation for, again, 35, maybe 40 years now. So it's definitely been in the market. So that being said, a lot of doctors do know what it is, and they do know how it works. And there's a lot of trust for the actual technology in certain, niches, if you will, of the medical industry, where some doctors are used to using it and some not, some do it on a regular basis. But there's a reason why you don't really ever have a lot of widespread use of this, and I'll explain that here in a moment. But the electroanalgesic therapy, what it's doing is it's producing pain neuron depolarization. So the electrical current hits the nerve and actually depolarizes the neuron, de-escalating that pain and inflammation cycle. And most doctors will explain that to patients. Well, pain causes inflammation. Inflammation will trigger more pain, and that cycle keeps going. Well, most of your pain treatments out there, medications, procedures, they're all trying to interfere with that cycle. That's what they're trying to stop. And that's what this treatment actually effectively does, is interfere with that cycle, depolarizing the pain neurons. It cannot report the pain. And then the other component of benefit here is that when you do depolarize those neurons, it releases a range of neuropeptides and neurotransmitters. The three that I like to point out to are endorphins, enkephalins, and GABA. Those three, that's a combination that a lot of doctors would consider the combination of a runner's high. So the way that you feel after a good run or a good workout or a good hard day's work, that really good sensation of feeling physically after all of those activities, that's the sensation and feeling you get after doing the electroanalytic therapy, right? So you have that good feeling, but also too the reduction in pain because you've interfered with the pain signal. So feels great. Patients get better. This program is designed to be an actual program. You have to have the actual electrical therapy needs to actually work with you for a period of time for it to be effective. So the treatment program, it is a 1 hour treatment 2 times a week for 8 weeks. That's the program. All right. So when a doctor orders this for you, they're saying, okay, we're going to work on this for 8 weeks. We're going to do these 2 sessions a week, right? And as a mobile program, the nurses will reach out to you, and after you've been, screened and cleared for the program by the physician, the nurse will reach out to you and say, "Okay, when do you want to start? 2 days a week. Let's get it scheduled, and let's book that out for 8 weeks on the schedule." So there is no interference with when things are happening for 8 weeks. It's perfect. So the reason you need this actual several weeks of treatment, there's a cumulative effect that occurs with this treatment. If you did one treatment for an hour, you might get a couple of days of outcome. And it would actually probably be fine. And I've actually seen this happen like a lot. I've actually seen probably hundreds of scenarios where somebody got a single treatment and then it only lasted for a few days if they only got one. And I've actually had a friend of mine actually who had a pain issue and he got one treatment and it, was not able to do anything else. And he said, yeah, it lasted for about almost 3 days. Right at the third day, started having pain again. So that's why if you want it to have a long duration, you need to actually do multiple treatments. So you would do twice a week to maintain the effect and keep that going for 8 weeks. The cumulative effect of this is that if you complete this whole program, our anticipation, our expectation is that you should have somewhere between 3 to 6 months of ongoing relief. So we'll talk about the efficacy of this, like what the success rate is here in just a minute. But the outcome and the duration, that's why it needs to be 8 weeks long. So you do 8 weeks of treatment and you get months and months of outcome for it. I've seen plenty of patients go 6+ months, and I've seen a number of patients that have gone over a year. I had a patient I talked to who was telling me that he had gone over a year. And since he had finished the program, it was over a year later since then. He was still feeling decently well. He said, I just started having pain coming back in the last few weeks. And he's like, I'd like to do the program all over again. So, if it lasted for a year after doing just this 1 8-week program and you didn't even have to go into the doctor's office to get it because they came to you, it's kind of a hard option to turn down, if you will. So that being said, the program works amazingly well. So the second component is the IV nutritional hydration. So that IV hydration component, there's so many aspects of value in the hydration. It's just a vitamin mineral mix. Most chronic pain patients are chronically dehydrated. And they are chronically deficient in some nutrient, vitamin, mineral, various ones. There's a number of them. Again, there's multiple chronic issues going on. It's not just chronic pain; it's chronic dehydration and chronic, nutrition deficiency and things like that. So the IV hydration really helps. Over the years, we've noticed that the people who engaged in the IV hydration component had a faster onset of success, so they would start working faster. When they got the treatments, they would have a stronger outcome. So it actually would get better. So if you're on hypothetically, if you were, getting down to a 4 on the pain scale with just the electrical therapy, then maybe you're getting down to a 3 if you added in the IV and stuff with it. So just people have a better outcome. And then it have a longer duration. Typically, people who had the IVs would actually have a longer success outcome after it was over. So, the third, and by the way, the hydration, the IV combined with electrical therapy, that is actually probably one of the key ingredients of the overall success of the program, because that combination, there's a lot of really good physiologic benefits that are occurring in that combination. And I could probably talk for hours about some of the actual specific physiologic changes that are occurring when you have them both working together. But that's what we've noticed over the years. That's part of the whole program. It works extremely well. So the third component, health coaching. And a lot of people would say, oh, I don't need health coaching. I know, eat vegetables, get some exercise, get sleep. things like that. So that's not all there is. There's a lot more to it. But one thing that we have noticed, and I've seen this many, many, many times, patients who are in chronic pain just have very little motivation or incentive to try and be healthier. And I've seen lots of programs out there that were saying we're going to treat chronic pain by just being healthier. And I'm like, and of course the patients are like, well, I'm still in pain today though. I mean, being healthier is probably going to help me with pain down the road. And that's very true. If you were much healthier and better and eating really healthy and eating clean and all these things like that, yeah, you would probably get out of pain or significantly reduce your pain sometime down the road, some aspect of later in time. But it doesn't help necessarily today, per se. And a lot of patients are saying, well, I'm in pain, like I'm right now, I'm in pain and I need treatment today, which is why so many pain doctors are only able to really recommend something that is right then. Like, I can help you do something now. Like, I can do this spinal injection, I can prescribe this medication for you. Those are things I can do today that a pain doctor can offer you, right? And that's why you see that being the primary model of pain treatment. Now, take that same concept and multiply it times hundreds or even thousands of patients, and now you have a pain doctor who does not have time to do a program with you. It's just, I've got to do this one thing and I got to move on to the next person because I got 20 people waiting for me, right? And that's what they're dealing with. If you want to know why doctors don't know about this or that they don't do it, the ones who do know about it don't do it. And that's exactly why. It's because they just don't have time to deal with this. If you're talking about an hour per treatment in the office, and it's twice a week, the doctors just don't have time to do that. And I know they're not physically doing it themselves, that they have staff, but even with the staff, you're looking at someone is taking up a seat in a spot in the office for a whole hour. There's some equipment involved specifically for that patient. There's a staff member who needs to be present. You could probably only still treat a few patients, even if you did have a room set up for this. So there's just not, it just is impractical to try and operate this out of a doctor's office. And I know a few offices who do structure their whole office to try and accommodate this exact type of program. And so, yeah, it can be done, but almost all of the other doctors in the country are not really able to accommodate this program in the office. That's why you just don't see it, right? Being offered, despite them knowing that the treatment works. They know, the doctors that do know what electroanalgesic therapy is, all that stuff, that's great, but they can't really make use of it. It's just impractical for them. So that being said, efficacy of the program across the board, 85% success rate. That's according to all the doctors we've worked with and talked to. We've asked for their opinion and their thoughts on what is the success rate on average for all the patients going through the program. That's what we've heard from most of the doctors out there, is just 85% success rate of achieving a greater than 50% reduction in pain. That's what they're seeing. So the other aspect of this, some conditions actually have a better outcome rate. So doctor, we'd ask them, are there any conditions that you feel perform better or have better outcomes than the average? Oh yeah, neuropathy, fibromyalgia. There's a couple of others that they would mention, having better outcomes, 90 to 95% successful. Now, when you start getting anything that high, everybody starts hesitating on actually saying that. Well, I'm going to say 90% because well, that's pretty high. And they think about it, they're like, well, it is true though. Yeah, 9 out of 10 people coming in their office are having a successful outcome with their neuropathy pain, and that would be that having a greater than 50% reduction. So, I mean, it's what they're seeing, right? It's what they're seeing. It's what they're saying. The doctor believes that that's what's happening. And most of the patients going through the program are having success. And, I've talked to and or discussed this with hundreds of patients. And yeah, I mean, it absolutely works for them. So, okay. 85% success rate across the board, a couple of dozen different types of pain conditions. But today we're talking about specifically about chronic peripheral neuropathy pain, and now having that as a mobile treatment option in Virginia. So, okay, how do you get started with this? Well, first thing you need to do is reach out to us or to one of our nurses, but we do have a whole website dedicated to operating this whole program. I have a link in the description of this video here. You can click on that and go to our site. We are covered by Medicare and commercial insurances. I don't think I mentioned that yet, but yes, we are. We are a non-pharmaceutical, non-surgical, non-invasive and non-chiropractic pain treatment program, and covered by Medicare and commercial insurances. So and it's available in your home as a mobile program, right? How do you get started? So fill out the form. We have a form. You can actually fill out the information, the actual insurance form as well. We is covered by insurances, but we do need to actually do that verification of your insurance, right? But if you want to talk to somebody before you do that, that's fine. But one of the first steps that will need to happen is to just make sure we can check and see what your coverage is for you. Get you set up with one of the providers, physicians who can actually talk to you and order the program for you, and then get you scheduled and connected with one of our mobile nurses who will come out to your house and deliver the program for you. I really hope that anyone out there watching this who has chronic peripheral neuropathy pain is at least willing to try this option, because it is safe, it's effective, and it's covered by insurances. So there's really not a whole lot of reasons not to try it. And I hope that everyone can be educated on what this is, neurofunctional pain management, how it works, and being able to have it in your own home makes it a pretty easy decision to make. So I really hope all of you out there can reach out to us and get started. Again, follow that link in the description, and we look forward to seeing you. Thanks so much.